you very much, and welcome to my. All right, well, thank you very much, and welcome to my presentation on diversity in healthcare leadership and why it is so important now. I appreciate you being here to listen, join in, and discuss DEI and B opportunities, challenges, and ideas. I will be specifically addressing DEI and B in healthcare leadership, but I also believe that this information will be valuable and applicable to all industries. Now let's get started. Our agenda for today will be centered on the understanding the current landscape of healthcare leadership, what's happening in leadership, and what does the healthcare workforce look like that healthcare leaders are attempting to lead and guide. We will also be looking at challenges of the leadership and why diverse intersectionalities are not in healthcare leadership and why there is not enough diversity at the healthcare system and services leadership levels. Then we will roll right into um, opportunities to create diverse biographical, experiential, ethnicity, cultural, social, and shared elaboration leadership teams, and then be given some opportunities to ask questions, make suggestions, and make recommendations for us to share with one another. I do want you to see that at the bottom of the agenda it says being different does matter and it shows because my belief is that a homogenous world is a world that is without color or without life. And our differences are what make us unique and what gives us the ability to create an event and be innovative in our working world, especially in healthcare, where we are working with multiple different lifestyles, multiple different patients, and multiple different um, experiences that we have in our world. But before we get started, I'd like to find out who is in our audience. So I'm going to have you take a poll that will kind of show me who we are working with. So, I apologize. I apologize for the difference in being able to use the slides on my end. We will go quickly back through the agenda. We will talk about the beginning of the information on the landscape of the current healthcare leadership process, processes, as well as looking at a healthcare workforce. As we will also look at identifying the challenges of leaders and why there is or is not diverse intersectionalities within the healthcare leadership role. And then we'll also look at opportunities to create diverse biographical, experiential, ethnicity, cultural, social, and shared elaboration leadership teams, followed by an opportunity for questions, suggestions, and recommendations. I did say earlier that I think it's important that we, throughout this presentation, begin to understand that being different doesn't matter and it does show. I believe strongly a homogenous world is a world without life or without color. And we have so many different things and unique things about us that allow us to be able, that should allow to be able to collaborate well together. So I'd like to know who is in our audience today. Um, so we have our first poll to come up to have you guys fill it out, and then we'll talk about it as soon as we're done. So if you are attending today, choose the best single choice answer.
All right, we're at 86%. Do you want to give a few more minutes or you like me to go ahead and share the results?
Uh, yeah, maybe just a couple more seconds, not necessarily a few more minutes. Okay. 90% would be good. There we go. Oh, fantastic. So we do have the majority are health leaders, but definitely leaders in the industry are a part of this as well. So I'm very grateful you are here. I also appreciate the fact that we have healthcare people that are not a leader, because you're probably an emerging leader if you are not already a leader. And I appreciate those also in another industry and those that are retired as well. Thank you very much. So on our slide 3, I collected a great deal of information from the McKinsey Company and Lean In Women in the Work series of research that they have done over the years for their for defining what looks like work for women in a bunch of different industries. They do also draw out healthcare industry information. So this is what I'm sharing with you on this slide. That in all women healthcare, and when they say all women, that means all women of color, all religions, all intersectionalities, so that in all women healthcare leaders, an increase of 13 percentage points is seen at the senior vice president role, and that's pretty significant in a 2 year time frame that they're reporting this. There were smaller gains, 1 to 4% were in entry level roles, which is a supervisory role or a manager role, as well as executive director or director roles for all women leaders. There were no gains or no changes seen in the roles of vice president for all women leaders. And the C-suite roles were decreased by 2%, by 2 percentage points for all women leaders in healthcare. These percentages are also reflective of all industries, corporate leadership as well, and there was a small or slight increase in C-suite for all women and men of color. And we'll look at that data on the next slide. What's happening now is this information is from the pipeline research that McKinsey and Company and Lean In do for their Women in the Workplace series. So there's a section on women of color from their 2018 report, as well as the 2022 report, men of color, white women, white men, and all women in healthcare leadership. You will see that there's an average of a 1.8% gain for women of color, and that's through the whole line from entry level to senior vice president and C-suite. And the slight gain was only in senior vice level. You see, this is just a 2 percentage points variance between year 2008 and 2022, and a 1% at the C-suite level. So there's not a whole lot of gains, and that is traditional. That's traditional for women of color. That's all women of color. And the men of color had a great percentage increase based on their positive, based on a positive 3.2% gain in all of their levels, but they had a larger gain in their senior vice president and C-suite levels of 4 points, which is an actual, that's unheard of in the data that they have gathered in the last 10 years of this reporting. So this is significant, and we'll talk about why it's significant in a couple more data sets. The white women category, while they made some great gains in the senior vice president and C-suite levels at a positive 2% or above, they stayed stagnant in their manager, director, and VP levels, as you'll see right here, and then even took a drop in their entry level areas. This is significant as well because it simply means that maybe they're not getting into the entry level areas, which is important. If they can't get into the entry level areas, then it's going to be different getting into senior vice president and C-suite levels as well. And then also staying the status quo here at the 3 other major levels that they kind of need if they're trying to climb the ladder, which means, again, that glass ceiling paper sealing, concrete sealing, whatever you want to call it, may be in effect in particular areas. For white men, this is a significant one as well, is 2018 to 2022 was a drop of a negative 5.6% in white men in leadership levels, with them taking the biggest hit in the senior vice president and C-suite. So this may be where men of color and white women are taking the lead in those positions. Now, while this is a good exchange of processes, we're wondering, is it just a resignation rate at which white men are stepping down from the roles, or are white men going up to even higher levels? They're now on boards and doing different things, and that was, or maybe they're just retiring. But apparently, the people who are filling the roles that they are vacating are white women and men of color. And then when we looked at all of the women in healthcare leadership data, there was a slight increase overall of a positive 2.5%, and especially their largest increase was in senior VP level, which is excellent to see that. But we also see that there was a drop at the C-suite level, which means, again, is glass ceiling going to be here for women in healthcare leadership, and that's all women. Um, race, cultures, everything are in this one category. And so you're not sure while this is a good number and looks like a good number, is this where it's going to stop? Slide. All right. We're going to begin to talk a little bit about a variety of information that I have discovered along the way in preparations for this presentation, as well as for my own dissertation and research. It's a good overview in which I am able to compare how healthcare industry leadership compares to the private sector, compares to nonprofits and other corporate industries. It allows me to look at healthcare through a different lens. What works in one corporate private sector may not work in healthcare, but also vice versa may occur. But it doesn't mean that we can't utilize that information to help us improve how we're doing in the healthcare setting. So first off, diversity is limited in healthcare leadership, with Black executives represented more heavily in diversity and equity roles at the top of the 100 leading U.S. hospitals. This was reported by Chartis Group and by the National Association of Healthcare Services Executives in May of 2021. Of the 100 hospitals, 46 of them had at least one Black leader in this C-suite role, which led to a 10% of total C-suite positions in this particular sample. There were also executive roles with the highest percentage of Black leaders, which was diversity and equity at 81%, human resources at 32%, and operations, which is a COO position, at 12%. In another reporting through Becker's Healthcare Review, which is a e-newsletter that has been around for years and crosses information from all over the healthcare industry. And in their particular study, they found that only 6% of CEOs are Black. In some of my research, I found that in healthcare systems, 91% of C-suite and senior vice president positions are held by white males. That has dropped a little bit to around 89% in most recent years in the 2022 data, but it's still the significant dominant culture in healthcare. And then women of color in healthcare hold about 4 to 6% representation in hospital leadership and in governance boards. And color, unfortunately, stay within that 4 to 6% in the process of in the process of leadership and in board service. Slide. Now, this is a bit of data that you might find interesting in that, according to the Washington Post, many companies are reporting their 10K filings for the SEC are now required to use and have plans of diversity and inclusivity. So they're beginning to use terms like diversity, inclusion, racial justice, equality within their reporting structures. What's important about this was that within this data, there are healthcare companies that are doing this same thing. And these companies were listed as Merck, Johnson and Johnson, Eli Lilly, Thermo Fisher, Abbott Laboratories, United Healthcare, Pfizer, and Procter and Gamble. In another report I found, C-suites in corporate America, and this is all corporate, not just healthcare, are still disproportionately white and male. We see severe underrepresentation of women, Black and Hispanic and Latino executives in most C-suite positions. So just a couple more slides to give you a nice ground and foundation of information. And so according to Zippia.com on their job board platform, which looks a lot at chief executive officer information, they found that there are over 42,356 chief executive officers currently employed in the United States. 31.5% of them are women and 68.5% of them are men. The most common ethnicity of chief executive officers in the US are white, which is at 76%, followed by Hispanic or Latino, and you see that huge gap there of 7.9%, followed by Asians at 7.8%, and then they had an unknown category that could be just about any ethnicity, any religion, anything within this group. There's no definition for that, which means there were people that didn't identify, maybe in order to feel comfortable about participating in their due process. That is at 3.9%, but below that then rest Black and African American and the American Indian and Alaskan Native. This was also one of the few places where I found information on the LGBTQ population, and they have chief, or at least those that were able to identify that 12% of all chief executive officers, and this is all chief, not just healthcare, were LGBTQ. Also, in the Asian population, Asians can constitute about 20% of physicians, but only 6% of hospital C-suites. And East Asians are just over 1% in the hospital C-suites. The same kind of trends in other businesses and in sectors as well. And the information as we go along, you will see how this kind of fits in and how it really becomes almost a detriment to Asians in healthcare specifically. So, in summary, still the majority of white men are in leadership, with men of color and white women making the biggest gains at the C-suite and senior vice president levels. Women of color, their status quo, with the small gains at the senior vice president level, with about 12% of LGBTQ persons incorporated in the data for the C-suites. But also be aware that there are smaller percentages of unknown, smaller percentages of people with disabilities in the leadership levels that we're not able to right now at least capture the data in the leadership processes. So in healthcare, what is also important as leaders in healthcare is that we look at our healthcare force. Are we mirroring our healthcare workforce? And if we are or are not, how can that allow us to be able to utilize our diversity in our workforce to help bolster and improve the diversity within our within our leadership? Next slide. So in this particular data, this was taken during COVID in 2020, and they're looking at 22 million US healthcare professionals in hospital settings. So this doesn't include the whole industry of healthcare, but specifically focuses on hospital settings, into the outpatient facilities, and medical practices. So there's about 22 million US healthcare professionals. 66% of them are women and 44% of them are men. In the race and ethnicity category, the majority of are are a white European Caucasian at 60% or below, because that unknown number is also allocated within that data. And then it goes up to Black African Caribbean, which are 6.2 million at 16%, to Hispanic Latino, which is about 2.4 million, which is about 13%, and excuse me, and then Asian Pacific Islanders and Native Americans at 1.4 million at 7%. With also in this data and in this group of information, we found out that the LGBTQ population is reporting at 4% of physicians and medical students. And remember, this is a population that is just beginning to get some ground with their information, because they're willing to speak out and support, yes, I am in the LGBT population. And so that's why you see the numbers being so smaller. I'm assuming that the numbers will probably be a little bit bigger as people feel more comfortable reporting that they are LGBTQ. The U.S. Bureau of Labor Statistics also reported that 7.9% of persons with a disability were employed in a healthcare role. That includes practitioners at 4.4%, in healthcare support positions, which are like our IT departments, our finance departments, our cybersecurity departments, our health records departments, at 4%. And so this whole population includes physicians, nurses, therapists, aides, assistants, EMS workers, anybody who works within a health system process. But if you look at whether or not leadership is mirroring workforce at this point in time, they are mirroring the workforce. The white population is still and white women population is still in the workforce at the highest level. So they can make the case to truly stay the same if they choose to. But I think the challenge is here is that white males that are the largest population in the workforce is actually women. If you look at the statistics of 66% of the healthcare workforce population are women. So we could make the case that there still needs to be more women in the higher leadership ranks. And in this, we can assume that we also mean that it also means women of color as well, and women with disabilities, and women that are in the LGBTQ population. I believe that a diverse workforce deserves a diverse leadership. This particular information is just giving you as a tidbit of a sample of, in the Hispanic population, which in 2020 was about 60.1 million Americans, only 10% of all healthcare workers were Hispanic. They truly believe that whether it's Hispanic or Latino, Black, African, Caribbean, or Asian Americans or Asians from other countries, that recent stats with any of the races and differences in cultures, that representation of, like, say, Hispanic American healthcare workers will encourage more Hispanic individuals to pursue a career in health sciences and allow Hispanic American patients to better connect with their healthcare providers. This is the same for any race or culture that will be different going to a patient. So if we have more representation in the workforce for our communities and for patients we serve, they're better able to get better outcomes because there's someone who understands their culture and their beliefs. I've given you a lot of information in the last few slides about the makeup of leadership, all industry, the healthcare and hospital industry, and the healthcare workforce. The reason why a diverse workforce is so important is because this is for our patients, how we treat our communities, but also that our leadership is part of the team and is actually considered part of the workforce when you look at the overall applications of our patients to the workforce, in relation to the workforce. So now we will go on to look at the challenges and why this is so difficult to create a diverse leadership, um, uh, to create diverse leadership role. roles. But part of the challenge, what I actually need is some additional information from you. So we're going to have our second poll where we will look at the challenges to DE&I programs that maybe you have experienced in your world. So how do you rate your organization's or your company's DEI&B efforts? Check all. This is multiple choice. All righty, let's see here. It looks like our top one, which is good to see, at 70% is improving each year or month on communicating what they are doing, and that's very good to see that. At 25%, we have a full-on development of principles and activities that are inclusive of all, and that's also excellency. And I can feel and see a difference in the culture is at 20%. And then we had at 15%, they started but stopped and haven't seen the efforts in months, which is kind of some of the data that I've been seeing actually is very relevant to the choices that you all selected here. That we see in certain sectors and in certain areas, and even in certain hospitals and certain healthcare facilities, we've seen a great growth of communicating and understanding what they need to do with principles because they've actually put people in place to help drive those initiatives. As well as seeing the full developments. It even may be at a smaller percentage, but it's still there, and that's significant. That means that we're trying. That means that we're working at it, and it's still difficult, especially post-pandemic, for hospital facilities to continue to, if they've started something pre-pandemic, trying to get it started back up after the pandemic has been a challenge for most hospital and healthcare facilities. And I'm glad people are feeling a difference in the cultures as DEI efforts are continuing. So it's good to see that numbers. I'm really happy that there's a never started effort at 0%. So excellent information to have. So with this area, I'm not going to read all of these to you, but you can see that what the challenges are, and this is in any industry as well as in healthcare, that women of color experience white males and females with less experience, education, and qualifications promoted over them. The LGBTQ population is not necessarily willing to speak up in their leadership or in the workforce roles simply because if they participate in after-hours activism or if they are talking about it on their job, they kind of have, there's that fear of retaliation at work if there's information or if they're seen participating. Asian American leaders, which is, remember, the data from a couple of slides ago, where we talked about they were all in the physician roles, they may have been in the finance roles, and they get pigeonholed into these roles as very much like a stereotype, and don't get promoted any further because they should stay a physician, they should stay in the finance world. That's not necessarily the case. They also would like to move forward. Ageism has become a huge picture for both the younger and older generations, because if they're too young, leaders feel like leaders feel confident that they don't know how to address complex problems. That's a challenge for younger leaders. Truly, actually, if you're COVID, they know exactly how to deal with complex problems. And if you're too old, the leaders believe or feel that you don't have any more to give, or that you don't have any more information to offer, or that you're not computer savvy enough for this very IT oriented world. And then women and men of color often do not speak out about microaggression, as they don't want to be seen as complaining or overbearing or aggressive, or culturally stereotyped as over the top, or as divas, or um, strong black women or angry black women. So nobody wants to be seen as that, so they don't report that. And then Hispanic and Latino leaders are often stereotyped in service roles, or only being able to be over departments of cleaning services, facility services, or hospital or campus groundskeepers, which is also an unfair role to place them in, when that may be their stepping stone to additional role within your health system or in your organization. They are well beyond um, uh, those roles, because they are also educated in becoming a leader. And so opportunities are often, for any of these groups of people, opportunities are often um, not made available because of the stereotypes that they're going through. In the next slide, we're going to talk a little bit about overall organizational levels and why the challenges are occurring. Most of the time, and in some of the research that I've found, hospitals especially now have a set of standards through their accrediting bodies that allow us to provide care and service at with compliance standards and metrics established with that. While they may be a mandate to do it, it doesn't necessarily mean that healthcare systems are all on board with doing that. And within that process, is part of the reason why that occurs is because there is poor or no senior executive leadership engagement. We all know how important it is for senior leaders to be engaged in the process, even if they're not quite sure how to be involved. But the leaders must set the example for the appropriate leadership behavior that they want their organizations to demonstrate, and for positive recognition. If they do not, there's consequence associated with inappropriate behavior, as there are if we don't achieve our budgets, say in a financial reporting time period. And so that is a challenge. And so with executive leaders not participating, engagement becomes difficult. DEI is often looked at in the same light as affirmative action, and we all know, excuse me, we all know the challenges that affirmative action has gone through recently, um, and with that likeness to affirmative action, DEI also has challenges, even making it through as being an effective way to create diversity among everyone. But please remember, affirmative action was designed to work for a marginalized group of people. So it was designed for a certain population of people in order to get them to a level where they could be just as competitive or just as qualified as the dominant culture. And so they were specifically looking at a certain level, a certain group of people in order to do that. However, DE&I is not built that way. DE&I is actually meant for everyone. It's just that everyone doesn't see it that way. Then there's the historical and recurrent biases. all our personal, long and held beliefs, whether they're negative or positive, about different cultures. Anything that is different than ourselves, we feel is a threat to who we are. When we need to be a little more open about what someone else is thinking and how someone else is acting and why their cultures may be different than ours. Doesn't make their cultures wrong, doesn't make your culture right. It just means that that is how I have lived my life. And your bias that you set upon that makes it difficult for us to see beyond, what our long held beliefs have been. For healthcare systems, especially, and I know for other industries as well, the pandemic was a huge hit. A huge hit financially, a huge hit commitment wise in anything that we were implementing at the time because of how much it drained the system and how much it made it focus on just that one thing in order to live through the processes that we were going through. So if there were no DEI commitments or initiatives started pre-pandemic, it was very difficult to begin to start those up again right now. But our data is showing that people are beginning to do that. But DEI continues to be a challenge, especially for healthcare, because we're dealing with the staffing shortages, we're dealing with people with burnout and no energy to go any further because of the intensity of the last years. There's not a lot of funding put behind it, and there is no commitment to implement because resources are being drawn, obviously, to our patient care world, and the fact that we need to make sure that we've got enough staff to be able to do that, let alone to think we're trying to implement a DE&I program. And then there's our affinity to stay the same because it's comfortable, even if we know in our heart that it's not the right thing to do, and it may be, and we can even see that it's not the right thing to do, and but are unwilling to change because change is uncomfortable. We would still rather stay at the status quo simply because it's easy to do that. In this particular slide, I'm going to show you a 2-minute video that I found and thought it was great. It actually talks about the importance of diversity, equity, inclusion in healthcare. This is by Actrieve Healthcare. And you will see, I've already kind of outlined what you'll see in there is that they feel strongly that their implementation has helped to decrease the risk of staff turnover. They're able to use consistent metrics to improve and evaluate hiring practices, and they're improving communications between leaders and coworkers, which is a huge thing to be able to do that, as well as for healthcare systems. It looks greatly at since that link between leaders and coworkers is improving, that coworkers are able to provide better patient care, which of course results in better patient outcomes. So here's our video. So you have to click on the video. I have to go back to the other slide. Oh, I guess maybe not. I guess we're not going to be able to see the video.
Are you able to hear it?
No, I
Are
can't
you able
see it
to
on
hear
the
the
end.
video? I want to. You still can't see it?
Right. Yeah, I'm seeing the slide, just not the video.
Can you hear it? Are you able to hear the video when it plays?
No, I see the YouTube thing now. I can honestly say this worked when I was practicing. Can anybody hear the video? Because I can't hear the. Okay, yeah, I can't hear the video.
Let's see.
All right.
I'm sharing my I'm sharing the sound, so I don't. Let's see.
Okay. Oh, okay. That's a good idea. Someone says maybe if you drop the link in the chat, it we can do it from there. That might be a
Okay.
good thing to try. We'll try it one more time, and if not, we'll go on to the next slide.
All right. So I'll just share the link after. I'll send a link in the follow-up email.
All right, very good. All righty, so we will move on to our next slide, which is talking about getting opportunities for diverse leadership, um, which is slide 13. There we go. And before we start this discussion, we're going to have our last two polls because I would like to know if you've ever been a mentor or a mentee, if you've ever coached, if you've ever been an ally, if you've ever been a sponsor, and as before we actually start the discussion about creating diverse leaderships. So we'll do the first poll for this. Have you ever been a mentor, a coach, an ally, or a sponsor? Or have you ever supported an underrepresented leader or employee? Or I have not had the opportunity to do any of these. Oh, great, fantastic. So we have about 78%, which is our highest number of being a mentor. Our next highest is people have been involved as an ally or part of an ally group. And 17% are sponsors. That's an excellent number on that. But our next highest one is someone that you have supported an underrepresented leader or employee. That is really great. And then we have a few that have not had the opportunity to do any of these. All right. Thank you very much for allowing that information. All righty. And our next one, last actual poll, is also centered around this same topic. And have you ever been mentored, an ally, or sponsored? Or all of them? All right, great. People have been mentored at 88%, sponsored at 41%, and been an ally at 35%. That's very good. I'm very impressed with that. Thank you. I'm so glad that people have had the opportunity, because this will make the following discussion much easier, since you understand a lot of processes are to be a mentor, to be an ally, and to be a sponsor. What I think is wonderful about any of these uh, educational and experiential efforts is that it can either be done singularly or in multiple combinations of any of the six that we are about to discuss. In the next slide, we'll be talking about mentorship. Now, mentorship is a little different than coaching. As most of you know, it is a one-on-one relationship, building an opportunity, or you are focusing on the tasks of whatever is currently happening to your mentee. They're very driven by the mentee, by the mentors. Mentees to come with the topics and the agenda and to figure out the information that they want. As a mentor, you're providing resources and even introducing them to other people that might give them additional resources. And the recurrence of a mentorship meeting is based on the mentee's learning needs, that of the experiences that are occurring to them right now. I call that short staging. Where they're giving you stuff of what is occurring to them currently in the role, and then you're providing your experience and how you handle that, or them giving you ideas back about what they're thinking about, how they're going to handle whatever situation they may be in. Mentorship is an easy thing, as many of you are doing that and have been mentors, um, allowing you to reach into the pipeline for people who have not had the opportunity to be in a leadership role, as well as yourself being mentored into what the experiences that you're currently having. So mentorship is an easy way to get things started when you're looking for um, diverse peers or diverse emerging leaders. And the next slide is coaching, where usually coaching is a little different um, than mentoring, and that most times they are a certified professional. While it is a one-to-one or individualized process, they will focus more on self-discovery and self-awareness. So it's a very much a regularly and consistent process of meeting to look at self-discovery and self-awareness of whoever the leader is that's participating in the coaching sessions. They practice building skills and behaviors. They're looking at nurturing a rapid growth of you as a leader, or whatever your goals may be. And they're helping you to find key impact areas, so they aren't so much focused on the current task that you're working on, which is what mentoring does, but also looking at what you will do as a leader in the future. So discovering what you need to do, what other things do you need to learn, what things do you need to be aware about yourself that don't not necessarily contribute positively to you as a leader. So coaching looks at things just a little bit differently, and usually is worked on by a certified professional manager who sets up the agendas, gives you information on kind of what the topic is going to be about, and then looking for you to participate in that, so that you can create your leadership journey through coaching. The next slide is allyship. And allyship and leadership is a little different than allyship as an employee. As an employee, we've heard about the affinity groups, the employee resource groups, the groups that are that are all regarding race, or they're all regarding a religion, or they're all regarding a cultural icon, situation, or event that allows people to participate in certain things. And the peer and it, is elevated because of all of the peer support that you can get within it. For leaders, it can be the same thing. For leaders, we're still looking for peer support from other leaders. We're still looking for those of us that feel that we're invisible and not taught and are talked down to by others, becoming visible in an allyship work. As an ally, you can be the one helping to create positive alliances because you're in the group to listen, to understand, help foster empathy and empathy, and you're looking to understand a culture or another person's life that is very different than your own. In these groups, we can all be sheroes and heroes as we are developing our own skills to understand someone else's world and to align with what they're doing. These groups make leaders feel safe enough to talk about some of the challenges that they have as leaders, and then what is maybe the correct way in which I can interact with other leadership individuals or even my own employees that I am that direct reporting to me. Allyship gives senior leaderships more understand awareness of challenges that are the differences that biases have created for all affected intersectionalities. And this may provide a safe environment to voice biases that occurred before, during, and after a pandemic in healthcare. In the next slide, we will talk about sponsorship. Sponsorship is a very different. Sponsorship is a selected and process. The challenge with sponsorship is that if the senior leader that is doing the selection or that is doing the endorsement doesn't choose someone that is not like them, then it doesn't work to help create a diverse leadership team. So you have to, as a leader, as a senior leader who's doing a sponsorship program, it doesn't, it may not matter that they fit perfectly to the senior leadership style. It may not matter that they can attend or go to elite networking situations. So going to the country club or going to golfing or all the other things that kind of are at that higher level where someone before such as even myself, I would not have gone to any of those things, but the opportunity may be there for me to do that. I may not look like the rest of the senior leaders that are attending those things. This is also one of the areas where possible advancement can more quickly happen for a diversified leader, because simply if you're connected with a senior leader, have a relationship with the senior leader, they can drive your advancement a lot more quickly than you can by yourself. But it also gives the senior leader a stronger connection to what's happening in their own pipeline rather than using, what I've heard a lot is that, well, there's nobody in my pipeline that's qualified. Well, they probably are. You're just looking at only one group of people and not looking at a larger group of people that truly had, if they had just a little hone on kind of how to fit into whatever your leadership team is, then maybe there's a possibility for advancement quickly, as well as understanding what's in your pipeline. And the next slide, shared collaborations, actually is a word that I coined. It's a collective or a group of diverse leaders and informal leaders that are pulled together to share ideas and information, to collaborate maybe on a specific project where they're experiencing leadership training activities through designated times, through designated approved time. And collaborations simply are exactly what they sound like. They're sharing information, they're collaborating during experiential lab time, where it could be you're partnering anybody with, say, the manager from pharmacy with the director of claims data into one project. So two disparate jobs on maybe on two different campuses, even they've never even met, but you bring these people together to work on a particular project that has a limited time frame, and allow them to work together to develop leadership skills, understand a senior leadership role and how that works in that particular lab time. And creates an atmosphere of camaraderie and collaborations and connections with disparate departments that would not have communicated with each other in years, or had not even communicated with each other in years. This also creates for the person who's participating in the group a more agile and flexible job description. Whereas my traditional job description, this is what I'm doing, this is how I'm supposed to be doing it. But now I have this extra piece to add that I've been able to provide great work and great time within a different whole scope of work. And so it adds to that processes. But shared elaborations are good ways to create short-term achievements in diversifying your leadership team. And the next slide, which is a total full-on special development leadership program. Yes, these are intense, and yes, they are to truly do what needs to be done, are in a 12-month time frame. And so it really means that the senior leadership team is involved. It means that the curriculum is specific and specially designed to meet the needs of the to meet the needs of that particular organization. Because one health organization doing something not match their program may not need to be the match for the next program. So in this, best practices are the best practices that you develop yourself for your organization, because you are training the next level of leaders to understand how your organization works. So the curriculum is built on what you do in your organization, not what someone else is doing in their organization. But it gives you the year's time frame, gives you the time to add all that curriculum, add senior leaders in, and with to senior leaders and directors and VPs within the whole process, as well as to bring up a cohorts at a time of several different leaders as you're working on this, so that there's the opportunity to increase your diverse roles in your leadership teams if you're already training them to take those roles and those positions. But specialty development leadership programs are intense, but they're meant to be that way because you are creating those leaders. What is special about these programs that is tied to the specific healthcare system or organization, medical practice, ambulatory facilities, payer organizations, pharmacies, it can do any of that based on the duties, functions, and work of those particular organizations. All of this and all of the curriculum is related to the organization's goals and objectives, and every leader has a part to play. That means that everyone who works on the project and who teaches in the project and who learns in the project will make it a success because everybody's involved. So now we're coming to the end of the presentation. Again, I apologize for our technical difficulties, but I want to make sure to reiterate that cultivating a healthy and diverse healthcare leadership team is built on foundations of support from all six of these. Whether you choose to do one or you choose to do one, or to choose to do big things and incorporate different educational opportunities within that. But the foundation of support needs to be within all of them for the people that are participating in each one. Each one of these provides an opportunity for cultural opportunity environments that creates different sets of information on this particular culture, on this particular race, on this particular gender, that makes it more open and more safe for people to talk about their culture, their life, their roles that will affect how they do business within your organization, and how they perform as an employee, and how they perform as a leader. Everyone always talks about employee engagement, but you're expecting those same leaders who are struggling to increase their employee engagement, to increase their ability to make their employees want to come to work and do those things. But in this day and age, you're not taking care of your leader. There's no way that your leader can do that. So leader engagement is just as important, and any of these six avenues can allow you to be able to engage your leaders and increase your opportunities to have a diverse team. I'll go on to the next slide, but the next slide has a video in it, so we're going to pass that one up too, and we can put that one in the chat or the follow up as well. But it's one of the videos that keeps me filled with joy in the process of the daily things that we're doing as leader. So, in summary, I encourage people to have an inclusive and positive leadership. That an inclusive and positive leadership can be achieved in healthcare settings if all leaders and aspiring leaders are given choices that allow them to choose the best structure for their current and future leadership journey. If they believe that somebody is empowering them and believing in them, then you've got the ability to include people that you never would have thought of at higher leadership level positions. And a leadership education program can be designed specifically and specially for that healthcare system organization and its projects and services. It doesn't need to go to XYZ hospital down the road because they've got this phenomenal LP program and they want to be able to do the things that the hospital is doing. But that program may not fit what you need in your program. So, to your program is what will be most beneficial for you. And as leaders, we have the opportunity to be aware of what is holding us back and make the effort to adjust and do things just a little bit differently, look at things just a little bit differently than we have in the past, so that your emerging leaders look to you for guidance and direction in how things are going. Number 4 on the summary is if you are a senior leader, look at and through your pipeline for those hidden and informal gem leaders because they are definitely out there, especially those that are different than yourself. Be willing to enjoy being a sponsor and get training on how to be a good sponsor, how to be a good coach, how to be a good mentor in the process. You do lead training yourself, so train yourself to be a better sponsor. Train yourself to be a sponsor that actually will choose people not based on the fact that they look like me, so it's easier to talk to them, but you want to get to know another leader that's definitely different than yourself because you learn in the process as well. And if you're an experienced leader, take some time to become a mentor. Be a guide if you've never done it before. It's a two-way learning event, and I have thoroughly enjoyed being a mentor. I always learn something from my mentees. I truly believe that a healthy, diverse leadership can be achieved in healthcare if we understand how representation matters at all levels of the organization and how you fit in to make that happen. Because you have diverse skills as well, diverse abilities as well, and that is what is important in a diversified leadership team. And the next slide, I'm just letting you guys that I am book to my heart, have been all my life. So I'm sharing with you 5 books, some that are healthcare related and some that are not, but they have all had an impact on my leadership journey. Read part of them or read them through or create a book club or journal club or whatever you do. Use them to help you bring clarity, bring joy, bring motivation to improve yourself as a leader and to create curiosity to seek out more knowledge to become a better leader. And any of that can support our diverse workforce. I want to thank you for being such a great audience, for tolerating our technical difficulties, my technical difficulties, and participating in the polls and being curious enough to see what's possible and have an understanding of why representation matters in healthcare everywhere. And my contact information is on the last slide.